But when you coming to the functional medicine part, because I know we touched on it briefly, that you're looking at the system as it's like a biological system and everything is kind of integrated together. So let's say a patient comes in, where do you start? Like, what would, like, let's say I came to you, I have a condition that, or there's something I'm trying to be treated for. Where would you start, and what does that, I guess, methodology or process look like to start, making those changes that I need to make?
Great question. So the first thing I like to do with my patients is open their eyes to all the ailments that they're feeling at the moment. Because most people come to you with with the thing that's most pressing, right? Whether it's, let's say, anxiety or missed periods or constipation or constant bloating, whatever it is, right? It's the first thing that's the thing that bothers them the most. But then there's actually a lot of other signs that the body's been giving you for a while. You've just been ignoring. You're just not attuned to it. So normally what I get my patients to do before they come into a consultation is fill out a couple of health questionnaires. One of them is called the medical symptom questionnaire. And the medical symptom questionnaire was developed by the Institute of Functional Medicine. And the thing about it is it asks you questions about simple symptoms that occur on a regular basis, like headaches, dizziness, insomnia, swollen eyelids, teary eyes, so on and so forth, across the different major systems in your body. And then it gives you a total score. And it's fascinating because when people fill it out, although the major issue was, let's say, the digestive tract, they're lighting up everywhere. And that for me is the first sign to show them, actually, you have inflammation everywhere. Even though this is your main problem, look at all these issues that you've accepted as normal and you're living with it. The second step I do is really go through a deep dive into their health history and life history, because in medicine, in functional medicine, we believe that the story of your life is the story of your health. They run parallel, they're integrated. And it really goes to transgenerational health. I just did a talk for expecting mothers on preconception health, because we now have studies that show that what a mom does during pregnancy, pre-pregnancy and during pregnancy, affects the generation of her family 3 generations on.
Really?
Yeah.
Wow.
Yeah. So it's for me and for us when we're doing those consultations, we want to know first of all, we ask about genetic history. Like, do you have chronic disease in the family? Parents, grandparents, uncles, aunts, siblings, so on. And then the next question we ask is, what was your life in the womb? Right? So did your mom have a healthy pregnancy? Was she stressed? Did she smoke? Where did she live? Did she experience trauma? Did she live during wartime? All of this has a significant impact on the baby's development in utero, and that defines their health in the long term. How were you born? Were you born vaginally? Were you born via C-section? Were you breastfed? Were you bottle fed? All of this has a significant impact on the development of the gut microbiome, on the development of your immune system, on the development of your emotional resilience. So all of this is so important, because that gives me an understanding of what was their baseline to begin with. And then we look at, okay, well, let's now go through literally year by year in your life. What happened? How did you eat? How did you sleep? Did you get any infections? Were you exposed to antibiotics? Did you break anything? Did it heal properly? Were you bullied? Did you have a good relationship at home? Literally, we go through all of that, because that's all signals to me what has been happening throughout your life that gives me an indication of what was the tipping point. Because normally if you ask someone, when was the last time you felt really well? That's the point where things went, when the body was like, I can no longer cope. And that's the tipping point. And then if you understand that, some people have a very clear tipping point, like a major trauma or an illness or an infection. Some people don't have a tipping point that is a result of one trigger. It's actually multiple triggers that led to the collapse of balance in your system.
Yeah.
So it's really, we're like detectives. We're looking for clues. That's what we're doing.
Yeah, for sure. But I love what you said, that, and I've never heard anyone say that before, that the story of your life is the story of your health. I think that is, now when you think about it, I think that's so true. And it's so interesting how so many different little factors that or points in your life, whether it's trauma, whether it's stress. And I had no idea that even pre-birth you could have all these, you could have a baseline set for you that you had no control over to start with. So it's so interesting that you have to go so far back, understand what the whole story was, and then like go from there. When you're working with your patients, because I'm currently taking I'm getting my hypnotherapy certification, and I've
Great.
been learning a lot about the mind and how, and the power of the mind and how much it plays into so many parts of us that we're not even aware of. And when you're working with your patients, is how does the mental aspect come into play? Because from what I've been learning, that it kind of, if anything, all starts from there, your thoughts, your beliefs, how you feel about yourself, and then it kind of translates into physically in the body.
Absolutely, yeah. There's a great book called The Body Keeps Score. It's a fantastic book for anyone who wants to read it. And it talks about the impact of trauma, psychological trauma. And it doesn't have to be, major or minor trauma. And its effect, how it translates physiologically, because there's actually memory that is left in the body. It's like a physiological memory. So even though that you might have resolved the trauma, from a mental aspect, it might have not resolved at a physical level. For us in functional medicine, so we look at the body as 7 systems that are integrated, but at the core, at the heart of this matrix, we call it the functional medicine matrix, at the core of it is the 3 most important pillars: emotional, spiritual, and mental well-being. If those are out of balance, then anything we do around there is not going to work very effectively. The journey to healing would be very, very difficult, because there's so much you can do in terms of biochemical correction in the body, but the mind is extremely powerful, because your thoughts have a significant impact on your cellular biology. It actually affects the cell membrane, and the cell membrane is what the body uses to communicate whatever you're feeling into the cell, into the mitochondria, which is the energy powerhouse of your cell and your body. And so if for example, if you have limiting beliefs or very negative thoughts that you're constantly communicating with yourself, I'm not good enough, I'm not loved, etc., that's signaling messages to your body that produce inflammatory substances that are not helpful or healthy for the body, that really send you into more down the disease path. So for me, that's why when I studied functional medicine, I chose to also do coaching, because incorporating psychology and behavioral change is so important. As well as I'm a huge fan of Tony Robbins, but I'm also part of his leadership training program, because I want to learn from the best on how do you affect change, behavioral change very quickly, and you make it stick, right? Because and I know that, I'm sure while you're learning in hypnotherapy, it's quite difficult. And, he's the best in terms of NLP. So I really want to learn how you do that, because people's habits and the way they've been living their life is so entrenched. And sometimes it's really difficult when you dig down there, when you dig deep and you uncover those roots. It's uncomfortable. For people, it's uncomfortable. They've buried a lot of that and they're not ready to cope, to deal with it. But that often is this thing that is the block that prevents them from optimally healing their body. So there's no healing without mental, spiritual, emotional healing.
No, I totally agree. And funny you mentioned that book, because I'm actually reading it at the moment. It's I guess for a person with a non-medical background, it is a tough read. It's quite very technical. It's quite dense, but I try to take, I guess, the snippets and remember what they're talking about. But like you said, that book is so interesting, that especially when it was talking about things like PTSD and how people actually, like people who have PTSD, how does their brain work? What do they feel? Why do they still have those emotional reactions? And like you said, I think it's super interesting that you can mentally get over something or process something, let's say, but there's like a little, I guess, a scar would be the best way to put it, in your body that
Exactly.
you haven't healed yet. So let's use that example. Let's say we've dealt with it mentally. What do we have to start doing to address the I guess the scar in the body? Because I would assume if you've mentally gotten over it, then that would naturally translate into the physical.
Yeah, absolutely. One of the ways we look at your let's say how your how do we assess your emotional well-being based on trauma or experiences is we look at the hypothalamus pituitary adrenal axis. So we look at the HPA axis. And the HPA axis is essentially, think of it as the master conductor of the symphony of your life, right? It decides, you know, who plays when, what hormones released when, what neurotransmitter is released when, you know, what optimally, when should the kidney, this, that in the body function. So we want to assess how effective the HPA axis is, because the HPA axis is what registers messages from the outside world. So when you get stressed, it hits the hypothalamus, activates the pituitary, and then hits the adrenals. The adrenals are responsible for releasing cortisol and DHEA. Now, cortisol is, you know, gets a little bit of a bad rep always, but it's a very important hormone in the body, because it's the one that is released first thing in the morning when light hits your eyes. And it's your get up and go. It's what gives you the energy and the drive to function throughout the day. But then as the day passes, it needs to drop all the way to build sort of your sleep drive. And then towards the evening, that needs to shift so that melatonin is produced. So yeah, so the way we measure your emotional resilience and your capacity to deal with everyday stressors and major stresses in your life is by measuring your HPA axis capacity. And we do that by looking at your cortisol pattern throughout the day, because the pattern gives us an indication of how well you're coping. And so normally you release cortisol as soon as you wake up, and then it slowly declines at the end of the day. And then at night, there's no longer any cortisol, melatonin takes its place, and then that's how you go into deep sleep and detoxification and rest and stuff. The way we test it is through a 6-point salivary test. So you just collect saliva over 6 points throughout the day. And that pattern is a very good indication of what's going on in your life. So if you have a normal pattern, then it means you're quite emotionally resilient, i.e. whatever comes your way, you're able to cope with it. You're able to switch between sympathetic and parasympathetic mode quite effectively. So it kind of gives you an indication of the how well your autonomic nervous system is. If your cortisol pattern, for example, is flat and up or flat and down, below or the limits, or up higher than the limit, then we know that there's adrenal dysfunction, that your body is no longer able to cope with the daily stressors. And it's people, for example, you ask them, you know, are you able to multitask? Are you able to do more than thing at once? Do you get overwhelmed if, you know, you can't get something done, or if many requests come your way? If people are answering, no, I can't, I can only focus on one thing at a time, we know there's a degree of adrenal fatigue going on in the body. Okay. And it really has a lot of repercussions, because cortisol can lead to hypothyroidism. It can also deplete your sex hormones and result in imbalances in your sex hormones. Very dangerous. Well, not dangerous, but it's, you know, it's a major issue for females and fertility and just hormonal health, also in males. At the same time, it can impact your gut, because it causes your gut lining to become more leaky. So that results in toxins that are in the gut, normally don't cross the barrier. They cause inflammation of the immune system. It also shuts down your immune system, and so makes it less effective. So really, it gets a bad rep simply because if it's chronically elevated or chronically produced for a very long time, we have a problem. And so that's what we're trying to assess when we want to quantify that emotional or sort of mental overload. That's what we're trying to do, is we're quantifying it. Another very simple tool, if you don't want to do the salivary cortisol test, is a heart rate variability. Okay. And heart rate variability is is the variation between beat to beat in milliseconds. So, you know, it's different from the heart rate. Heart rate, you get a number, but that number you get is actually an average of what your heartbeat was over that past minute, because your heart doesn't just beat the same thing monotone continuously. That variation is the signals us of how well you can switch between rest and digest and fight or flight response. The lower your heart rate variability, the more you are living in that fight or flight response, you're unable to cope, and that creates disease. And the higher your heart rate variability, the more you are resilient. So it's a measure of resilience, because you spend more of your time the rest, digest, and restoration. And there's loads of things, loads of apps out there now, and gadgets. So the Aura Ring is a great one. There's the heart rate variability monitor from HeartMath that you can buy and use with an app, so that you can practice how to develop coherence and bring your body back into balance. Of course, hypnotherapy, acupuncture, there's loads of things that you can do. But I think that it's such an overlooked area. Stress is such an overlooked area in medicine. And it's gaining, of course, a lot of more traction now, because even in COVID, now we know that one of the markers of good or bad prognosis is how high is your cortisol to begin with. So if your cortisol levels are elevated and you get infected with the coronavirus, then the aggressiveness of the disease in your body is worse with a high cortisol level.
Okay. So interesting. All these things are so interesting. I just don't like how many factors that play into like just us as people and how we work between mindset, the things you talked about, like being able to measure your emotional resilience. I never even knew that was possible, that you could actually quantify how someone would respond like emotionally to a certain thing. When it comes to what I like from what I've understood today about functional medicine, it's a combination of, in a way, and correct me if I'm wrong, please, of therapy with medicine, because getting the life, like you said, getting the life story gives you what the potential symptoms could be, or like where is this actually coming from, what are the thoughts behind this, and then after doing that you provide a, I guess, treatment plan to fix those imbalances, or to fix what's like all the things that follow with it. But you start with the therapy part, or the mental part, and then it translates into the physical.